Hello to all you Nephro World Cup fans out there. We are kicking off by introducing our paper, a new renal inpatient screening tool, Renal iNUT, a multi-centre validation study published in 2019 in Clinical Nutrition, the official journal of the European Society for Clinical Nutrition and Metabolism. My name is Helena Jackson. I'm a renal dietitian who was involved in developing the iNUT and conducting the study.
Hello, my name is Nivedi. I'm a senior renal nurse at St. George's and was involved in introducing iNUT on our renal ward.
So as you know, malnutrition is common in kidney disease. About half of the patients admitted to our specialist renal wards may be malnourished. Malnutrition matters because it increases morbidity, mortality and length of stay. Malnutrition also increases healthcare costs by many millions of pounds every year. But how do you tell if your patient with kidney disease is malnourished? Weight and weight loss can be difficult to assess due to fluid restriction. Patients with normal or high BMIs may have low muscle mass, a condition known as sarcopenic obesity. Patients may also have long-term difficulties in eating, but not stop eating altogether.
Nutrition screening is the first step in the pathway in managing malnutrition. It aims to identify patients at risk of malnutrition. The earlier malnutrition can be identified, the easier it is to treat. In practice, nutrition screening is carried out by the ward nurse. It needs to be quick, easy, and support the nurse in formulating a care plan. Nutrition screening is widely recommended, but as renal nurses have not had a nutrition screening tool that was appropriate for our patients. Now there is the iNUT. Renal iNUT is a renal inpatient nutrition screening tool developed at St. George's in South London, England. We have been using it on our ward, on our renal ward, since 2012.
10 years already, Nivedi.
It aims to take account of some of the difficulties in assessing nutrition risk in kidney patients, but also to be quick and easy for nursing staff to complete.
The iNUT study was a multi-centre study in 141 admissions, comparing iNUT with a generic hospital screening tool and with subjective global assessment, a validated nutritional assessment method. Looking at the matched statistics now, the study showed that using iNUT, 50% of patients were identified as at risk of malnutrition and 36% needed dietetic referral. The hospital tool indicated only 20% at risk and only 7% needing referral. Patients in the high-risk iNUT group stayed 0.6 days more than the low-risk patients. Reliability was good. 71 nurses completed an opinion questionnaire and over 90% reported it to be easy to use and appropriate for their patients. So, as we reach full time, we should feel that we should win this round on goals scored. 1. This study validates a practical clinical tool in a real-life situation.
2. The iNUT tools were completed by renal ward nurses with their patients on a busy renal ward.
3. This has immediate clinical application for the many renal units that either have no screening tool or use a generic tool.
4. Nurses are better able to care appropriately for their patients, and dietitians can focus on patients that need them most instead of spending their time screening patients.
And 5. Using the renal iNUT means that many more patients are identified and treated for malnutrition. Yay!
Thank you.